Sometimes a kid goes to a doctor and he sees like a whitey, waxy material, and the whole drum seems to be infused by this, and he thinks there's something growing behind the drum, and he gets a good history, and they've had maybe a history of a perforation or a discharge of the air. What is that all about?
Well, the thing of concern when you hear about a white thing around the eardrum is that there may be a small cyst behind the eardrum, which we call a cholesteatoma. A cholesteatoma is a benign skin cyst in the middle ear, and it's benign in terms of it does not metastasize like a tumor. However, it does have a tendency over a period of time to grow, and since the middle ear is a very confined space with important structures in it, such as the bones of hearing, which we call the ossicles, the facial nerve, we don't want a structure in there growing and growing and potentially damaging them. So the worst possible thing when you hear about a white substance behind the eardrum is a cholesteatoma. There are other things that can be confused with a cholesteatoma. White plaques on the eardrum, which we call laryngosclerosis, or some people call tympanosclerosis, are just basically scars on the eardrum that usually have very little clinical significance. Also, when you have an external ear infection, sometimes you'll get white debris in the external ear canal that can also line the outside of the eardrum, the external surface of the eardrum, and that's a simple condition that's more commonly known as a swimmer's ear, and can be removed with drops and suctioning, and that's a completely different process than the cholesteatoma. But the one thing of concern would be this cholesteatoma, and that's if it's behind the eardrum.
How do you remove that?
A cholesteatoma will never go away on its own. It has to be removed. It may not be an emergency, but the only way to get rid of it is to remove it surgically. And depending on the extent or the size of the cholesteatoma, it may be confined just to the middle ear or to the mastoid, which is the bone behind the ear that communicates with the middle ear. And depending on the size and extent of the cholesteatoma, it may be able to be removed just by lifting up the eardrum through the external ear canal, again a surgical procedure, or an incision may be have to made behind the ear as well to get into the mastoid and clean it out. So it depends on the extent of the cholesteatoma. When a cholesteatoma is suspected, it's a good idea to get a CAT scan to help define the extent.
A pretty thorough workup,
Yeah.
so you know what you want. You don't do it blindly. Is that correct?
Correct.